Have you ever eaten something with complete confidence, believing you were nourishing your body, protecting your heart, and strengthening your brain, only to discover years later that this very food may have slowly weakened what you thought you were protecting? Many seniors experience this without ever realizing it. They feel dizzy more often. They forget words they used to remember easily. Their blood pressure fluctuates without explanation. Their sleep becomes disturbed, and they assume it is simply age catching up. But what if I told you that one of the vegetables you trust the most, one you perhaps buy weekly, prepare with pride, and eat believing it keeps you strong, can, after age 60, quietly create the perfect internal conditions for a stroke to occur? Not because it is inherently bad, not because you should fear it, but because your brain, your blood vessels, and your metabolism after 60 do not react to this vegetable the same way they did when you were 30, 40, or even 50. My name is Dr. Takamura, often introduced in Japan as one of the oldest practicing physicians specializing in longevity, cerebral aging, and vascular resilience in the elderly. For decades, I have dedicated my work to understanding the smallest mechanisms that accelerate or protect age-related cognitive decline. And today, I urgently need to warn you, because the brain of a senior is delicate. It is resilient, yes, but fragile in ways society rarely explains, and a single misunderstood food, consumed at the wrong moment, combined with the wrong ingredient, or eaten too frequently, can disrupt cerebral circulation in a way that remains completely silent until something irreversible happens. If you stay with me until the end of this video, I will guide you through the vegetable that increases stroke risk in the elderly when misused. 8 other vegetables that become unexpectedly dangerous after 60, how to continue eating them safely without eliminating them. Exactly when to avoid them and what combinations create the highest risk, how your aging brain reacts internally and why these reactions often go unnoticed, and the simple daily protections you can implement starting tonight. Nothing in what I will reveal aims to scare you. The goal is to empower you, calmly, clearly, and respectfully, with real medical understanding so you can safeguard your brain without unnecessary restrictions or worry. Let us begin. Why vegetables change their effect after age 60. Most people over 60 eat healthier than they ever did in their youth. They reduce sugar, avoid heavy meals, walk more, drink more water, and include more vegetables. But the surprising truth is this: the older brain does not simply need more healthy food. It needs the right healthy food handled in the right way. After 60, several major changes occur. Blood vessels stiffen, reducing their ability to expand when blood pressure fluctuates. Kidneys filter less efficiently, meaning certain compounds accumulate more easily. Liver detoxification slows, altering the metabolism of vegetable compounds. Cerebral circulation becomes more sensitive, especially to fluctuations in mineral balance. Oxalates, nitrates, and phytates, naturally present in many vegetables, are processed very differently. The issue is not the vegetable. The issue is the aging vascular system that receives it. This is why a vegetable that protected your brain at 40 can silently overload it at 70. And among these vegetables, one in particular stands out in Japan. The vegetable known to be strong, energizing, and iron-rich. The vegetable praised by doctors for decades. The vegetable nearly every senior eats thinking it is always absolutely safe. We will return to that vegetable shortly. But to understand why it becomes dangerous, we need to understand how food interacts with an aging brain. 2. The subtle signs. Your brain is struggling with a food you trust. In my clinical experience, the earliest symptoms are so gentle, so discreet that patients rarely mention them. Do you experience any of these? Light dizziness when standing. Feeling foggy or temporarily confused. A sensation of heaviness behind the eyes. Difficulty focusing on tasks that were once easy. Small memory lapses that appear randomly. Sudden fatigue after eating. A slight pressure on the forehead or temples. Episodes of mild imbalance without falling. Most people blame age. Others suspect stress or poor sleep. Some do not pay attention at all. But in Japan, among seniors I have monitored for decades, a pattern emerges. These signs often appear when a particular type of vegetable overwhelms the blood vessels, especially when eaten at the wrong time of day, in excessive quantities, or combined with specific foods that amplify vascular stress. And unfortunately, this happens most frequently with vegetables considered extremely healthy, because seniors often eat more of them than younger adults. This is where the risk lies. 3. The first vegetable, a silent risk for seniors' brains. Now let us discuss the vegetable that consistently surprises patients. It is celebrated, promoted in magazines, recommended by dietitians, cooked in every household, served in hospitals, and even associated with vitality and strength. That vegetable is spinach. Yes, spinach. Let us explore calmly, step by step, why this food transforms after age 60. 1. Spinach is extremely rich in oxalates. In youth, oxalates are processed efficiently, but after 60, they accumulate more easily, especially when kidneys filter more slowly. Oxalates bind to calcium, crystallize inside blood vessels, increase vascular rigidity, reduce cerebral microcirculation, promote inflammation in the endothelium. This combination is dangerous for a brain that is already aging. 2. Spinach concentrates nitrates. Nitrates are not inherently harmful, but in the aging digestive system, they convert more easily into nitrites, which interfere with oxygen transport, reduce blood flow to the brain, increase the risk of silent microstrokes. These microstrokes often go unnoticed but accumulate damage over years. 3. Spinach is often combined with the worst possible foods. Most seniors unknowingly combine spinach with cheese cream, fish, eggs, nuts. These combinations dramatically increase oxalate absorption and vascular stress. 4. Spinach consumed in the evening increases risk. This is rarely discussed. After 60, kidney filtration slows at night. Blood pressure naturally dips. Hydration decreases. Blood becomes slightly thicker. Eating spinach at dinner creates the perfect internal environment for oxalate accumulation, reduced cerebral circulation, overnight microvascular stress. This is when most silent strokes occur in the middle of the night when you are deeply asleep. 4. Real cases from my clinical practice. Over 25 years, I observed hundreds of seniors who ate spinach 4 to 7 times per week, prepared it in healthy ways, felt proud of their diet, yet many experienced sudden memory drops, numbness in the fingertips, unexplained imbalance, dizziness when turning the head, difficulty focusing early in the morning. One patient in particular, an active 76-year-old woman, ate spinach daily in soups, omelets, and steamed sides. She walked every day. She was healthy. She slept well. Yet, she began experiencing tiny waves of disorientation. An MRI later revealed microischemic lesions consistent with repeated microvascular stress, likely due to oxalate overload combined with nighttime blood pressure dips. She eliminated daily spinach, adjusted her meal timing, and the symptoms gradually disappeared. Not because spinach is bad, but because the aging brain needs a different strategy. How to continue eating spinach safely after 60. You do not need to eliminate spinach forever. Here's what I advise my patients. 1. Eat spinach only at lunch, never at dinner. This gives your kidneys a full day to filter oxalates. 2. Never combine spinach with dairy. Calcium binds to oxalates, creating harmful crystals. 3. Boil spinach for 2 minutes and discard the water. This reduces oxalates by up to 70%. 4. Limit spinach to twice per week. 5. Always hydrate after eating spinach. Water reduces crystal formation. These small adjustments transform spinach from a cerebral threat into a safe food again. 6. The other 8 vegetables that become risky after 60. Spinach is the first, but not the only one. Here are the vegetables we will analyze one by one in the next segment. Beets, nitrate overload affecting brain oxygenation, Swiss chard. Oxalate concentration similar to spinach. Celery increases nighttime blood pressure. Volatility. Eggplant contains solanine, stressing fragile nerves. Green beans, excessive lectins, reducing mineral absorption. Okra creates glycemic fluctuations that affect brain stability. Kale, high vitamin K interfering with certain medications. Sweet potatoes, large potassium load, stressing aged kidneys. Each has benefits. Each has risks. 7. The second vegetable, beets and the hidden risk of oxygen. Imbalance after 60. Beets are celebrated worldwide. They are colorful, sweet, rich in folate, and praised for supporting circulation. Many seniors appreciate them because they seem gentle on digestion and easy to cook. But after 60, beets behave differently inside the body. The primary concern lies in their extremely high nitrate content. Nitrates are transformed in the body into nitrites, and nitrites influence the blood's ability to carry oxygen efficiently. In a younger person, this conversion is well tolerated. The cardiovascular system adjusts rapidly, the brain compensates. But in an older adult, the scenario changes. With age, arteries lose elasticity, oxygen delivery slows, cerebral vessels respond less effectively, blood pressure regulation becomes fragile, red blood cells regenerate more slowly. Now imagine consuming a vegetable extremely rich in nitrates. The blood vessels attempt to expand to increase oxygenation, but stiffened vessels cannot adapt as quickly. This results in short periods of reduced oxygen delivery to specific brain regions. These episodes are subtle. They do not feel like an emergency. Instead, they manifest as mild confusion, a wave of sudden fatigue, a temporary difficulty finding words, a strange sensation in the forehead, a pause in clarity. Many seniors describe this feeling as, "It is like my brain shuts off for half a second." Over time, these repeated micro-episodes create cumulative stress on the brain. This is why Japanese geriatric clinics caution older adults to avoid eating beets on an empty stomach and never combine them with acidic foods such as lemon vinegar, pickles, certain fruit juices. Acid accelerates the conversion of nitrates into nitrites, increasing the circulatory load. Safe method of consuming beets. After 60, eat beets only at lunch, never for dinner. Eat them roasted or steamed, never raw. Raw beets release nitrates into the bloodstream more rapidly. Pair them with foods that stabilize blood pressure, such as small portions of healthy fats, olive oil, or high-fiber sides. Limit beet consumption to once per week. Handled correctly, beets can remain in your diet without overwhelming the aging brain. 8. The third vegetable. Swiss chard and oxalate overload in aging kidneys. Swiss chard often surprises people even more than spinach. It is colorful, leafy, and widely present in healthy diets. But what appears gentle is, in reality, a vegetable extraordinarily concentrated in oxalates. In Japanese longevity hospitals, Swiss chard is one of the first vegetables restricted for patients over 70, not because it is unhealthy, but because it overloads kidneys. It mineralizes in blood vessels. It promotes calcification in delicate tissues. It increases internal inflammation. It reduces cerebral microcirculation. The combination of stiffened arteries and oxalate-rich vegetables is particularly harmful to the aging brain because oxalates increase blood viscosity. Thick blood flows less efficiently to the brain. Reduced flow increases stroke risk. Inflammation promotes plaque formation. Swiss chard contains even more oxalates than spinach, making it one of the vegetables seniors should treat with the most caution. Symptoms that may suggest oxalate sensitivity: dull headaches, morning brain fog, mild heaviness in the temples, increased frequency of urination at night, tingling in feet or hands, slight swelling in fingers. These are not dramatic symptoms. They are soft, quiet, easily ignored indicators of oxalate accumulation. Safe consumption method. Never eat Swiss chard more than once per week. Always boil it briefly and discard the water. Avoid combining it with foods rich in calcium, nuts, or dairy. Drink water slowly throughout the day whenever you consume it. By adjusting preparation and frequency, Swiss chard becomes manageable again, but it must never be consumed daily after age 60. Celery is often associated with detox diets and light meals. It feels harmless, crunchy, refreshing, almost like water in vegetable form. But celery has a property that many seniors do not expect. It significantly influences blood pressure, especially at night. Celery contains natural compounds known as phthalides, which relax the walls of blood vessels. For younger adults, this effect is gentle and beneficial. But for older adults, especially those on blood pressure medication, these phthalides can interact unpredictably with medications such as diuretics, calcium channel blockers, ACE inhibitors, beta blockers. This interaction can create fluctuations, such as sudden drops in blood pressure during sleep, episodes of faintness upon standing in the morning, difficulty maintaining cerebral perfusion at night, increased risk of silent ischemic episodes. The brain needs stable blood flow during sleep. Celery consumed in the evening undermines this stability. The hidden timing risk. Most seniors eat celery in salads at dinner, in soups served in the evening as a late-night low-calorie snack. This is the worst timing. Safe consumption method. Eat celery only during breakfast or lunch, never at night. Avoid pairing it with blood pressure medications. If you are on antihypertensive treatment, limit celery to twice per week. Cook celery instead of consuming it raw. The effect on blood pressure becomes less pronounced. Celery is not dangerous when handled properly, but timing is critical for the senior brain. X. The fifth vegetable. Eggplant and neural sensitivity after 60. Eggplant, a staple in many cuisines, contains a natural compound called solanine. Solanine is not toxic in small amounts, but it is neuroactive. It acts on nerve transmission and can amplify neurological sensitivity. In older adults, even small amounts of solanine can provoke head pressure, sleep disturbances, mood fluctuations, increased sensitivity to stress, tingling sensations, palpitations after heavy meals, episodes of mental fatigue. Solanine also increases vascular constriction in certain individuals, reducing blood flow to the brain. Why seniors are more vulnerable. As the nervous system ages, nerve conduction slows, neurotransmitter levels fluctuate, sensory systems become more reactive, the brain becomes more vulnerable to chemical irritants. Eggplant is perfectly safe for younger adults, but for the aging brain, it can become destabilizing when consumed frequently. Safe consumption method. Always peel eggplant if you are over 60. The skin contains most of the solanine. Salt the eggplant slices and let them rest 20 minutes before cooking. This reduces solanine. Never fry eggplant. Frying concentrates solanine. Eat eggplant no more than once per week. Handled properly, eggplant becomes safe again. XD. The sixth vegetable. Green beans and lectins that interfere with mineral absorption. Green beans are popular worldwide, especially among seniors who want light, non-irritating vegetables. But few know that green beans contain lectins, natural proteins that bind to iron, magnesium, calcium, zinc. These minerals are essential for brain health, especially after 60. When lectins bind to them, absorption decreases dramatically. This combination can lead to fatigue, low concentration, memory lapses, reduced appetite, mood changes, sleep disorders. Most seniors experiencing these symptoms never suspect green beans. Safe consumption method. Always cook green beans thoroughly. Raw or undercooked beans contain high lectin levels. Avoid eating green beans more than 3 times per week. Pair them with vitamin C, not supplements, but foods such as tomatoes or bell peppers to improve mineral absorption. Drink water with the meal to help digestion. 12. The seventh vegetable. Okra and glycemic instability after 60. Okra is thick, mucilaginous, and often recommended for digestive comfort. However, okra contains powerful polysaccharides that influence blood sugar levels. In younger adults, this effect is stabilizing. But in older adults, blood sugar control becomes weaker, insulin response becomes slower. Glucose tolerance decreases. This means okra can unexpectedly cause post-meal drowsiness, sudden drops in blood sugar, episodes of mild trembling anxiety at night, poor sleep quality. The brain is extremely sensitive to fluctuations in glucose. Even a small drop can provoke cognitive instability. Safe consumption method. Eat okra only in small portions. Mix it with protein sources to slow glucose release. Avoid eating okra before bedtime. 2 servings per week is enough for seniors. 13. The eighth vegetable, kale and the vitamin K interaction with medication. Kale is often marketed as a superfood, especially for seniors, but kale contains very high levels of vitamin K, which interacts with blood thinners, anticoagulants, certain heart medications. This interaction can destabilize the blood's ability to flow smoothly, increasing the risk of both clotting and bleeding. For seniors with vascular sensitivities or stroke risk, this becomes a serious concern. Safe consumption method. Eat kale only if your medication allows it. Keep kale consumption consistent from week to week. Your medication dosage is adjusted to your usual intake. Cook kale instead of eating it raw to reduce vitamin K concentration. 1 to 2 small servings per week is enough. 14. The ninth vegetable, sweet potatoes and kidney strain after 60. Sweet potatoes are comforting, nourishing, and rich in potassium. For healthy younger adults, this is a benefit. But after 60, potassium excretion becomes less efficient. Excess potassium accumulates in the bloodstream, a condition known as hyperkalemia. This can lead to irregular heartbeat, muscle weakness, mental confusion, reduced blood flow to the brain, increased stroke risk in vulnerable individuals. Safe consumption method. Eat sweet potatoes in small portions. Avoid consuming them more than twice per week. Never combine them with other potassium-rich foods at the same meal. Eat sweet potatoes only at midday. 15. What all these vegetables have in common. Each vegetable has real health benefits, becomes risky only under certain conditions, impacts the aging brain through mechanisms younger adults rarely need to worry about. The solution is not avoidance. The solution is knowledge. Knowledge that allows seniors to continue enjoying a rich, colorful diet without exposing their brain to unnecessary risks.